Hi guys, welcome to day 23 of the Arora AKT 30-day challenge. Hope you're super well. Hopefully you're feeling good about the AKT exam coming up shortly in a matter of days now. Hopefully you're feeling good, you're feeling confident, and hopefully you're feeling ready. We've got another question for you today. As always, we're on to another clinical question today. Again, pause, have a think, go through the answers, think about what you'd put in that pressurized situation of an exam setting. 57 seconds to go with the average that you get in the AKT exam per question. Let's move on to the question right now. Have a think. That is time. Right, so first and foremost, the answer here is C. Well done if you got C. You do have to know your urgent referral guidelines like the back of your hand. Like you've got to, this is kind of barn door stuff that for AKT you do not want to miss out on. You do not want to get a question wrong that is testing your knowledge on the 2-week referral guidelines. It's bread and butter for general practice. Now, the reason I put this question in is because it covers a couple of really important things from a technique point of view and also what your mind does in the middle of an exam. So you see 5 patients in an afternoon clinic and one of them needs an urgent 2-week referral for suspected upper GI cancer. Which of the following patients does not meet the criteria according to the NICE 2015 cancer guidelines? So the first thing is spotting that does not meet as opposed to does meet. So again, these little words are really easy to miss sometimes because your brain looks at the big words, the cancer, the upper GI, and you miss the does not. So firstly, it's spotting that, and then secondly, it's basically turning it into false, isn't it? So changing does not meet basically into a single word, false. Which one is false? Which one does not need that referral? And the only one that doesn't need the referral that's matched here is C, a 71-year-old male with an upper abdominal mass consistent with an enlarged liver. You'd be thinking about an urgent ultrasound scan as per the NICE 2015 suspected cancer guidelines, not an urgent hepatology appointment. So the first thing there is to spot that. Now, the second reason I put this question in is that it's got a lot of similarities to a question that we did in one of our AKT long webinars that we do, the evening webinars that we do. So you may have been watching that live webinar that we did. It might have been the 6-week check. It might have been the 2-week hit. I can't remember. But we had a very similar question on here. You might have watched this back on YouTube. You might not have attended the live webinar, but you might have watched it back on YouTube. And your brain sometimes recognizes patterns. So you might have seen, oh, hold on, I've done this question before. And even these look similar in terms of the explanations. Now, 2 things were different in that question. Number one, it was which one of the following patients does meet. So it's different in terms of what you're looking for. And number 2, the ages of the patients were slightly different, even though the actual body of the text was pretty much the same. Now, if you remember back that webinar, you might have worked something out, got it wrong, figured out an answer, learned something, and then you come back into this question, and even though you might know the material, sometimes that memory of a past question or that pattern recognition draws you towards a certain answer. So for example, I think it might have been maybe D or B was the answer on that live webinar, with ages changed a little bit. And again, your brain may recognize that. Now, if you're doing lots of question bank questions and you're doing several types of question that come up regularly, like hypertension guidelines, AF guidelines, for example, you may pick up patterns that then you take into the AKT. And when you see something similar, your brain starts to push you towards certain things because you recall from previous questions. So it's really important that happened. Now, think really carefully. If you got that question wrong, you probably know the guidelines, but why did you get it wrong? Was it because you have pattern recognized from either the question that we did before in the live webinar, or something else that you've thought of before. But it's really important to acknowledge that and pick that up and realize that's what happens. So all the others do fit the guidelines. So 57-year-old male, we'll go through all these in a second. 57-year-old male with dyspepsia and weight loss needs an urgent OGD. Yeah, they do. A 42-year-old male with jaundice needs an urgent gastroenterology appointment. Yes, they do. Like we mentioned, C is incorrect because they need an urgent ultrasound scan. D is correct. 42 with dysphagia needs an urgent OGD. Doesn't matter what age, of course, when it comes to dysphagia. And then E, a 63-year-old with constipation and weight loss does need an urgent CT scan as per the CKS guidance, or the NICE guidance, I should say. So let's go through the 4 different things that you can do in terms of an urgent referral when it comes to suspected upper GI cancer. So you've got the direct GI endoscopy. So within 2 weeks, have an upper GI an OGD for 2 situations. Dysphagia doesn't give any age, so just dysphagia on its own. Or if you're over 55 with weight loss and one of 3 things: upper abdomen pain, dyspepsia, or reflux. So if you look back at A, 57 with dyspepsia and weight loss does need an urgent OGD. Secondly, you have urgent referral for basically a consultant review. So gastroenterology clinic, urgent referral, for example. 2 situations: upper abdominal mass consistent with stomach cancer, gastric CA, or over 40 with jaundice. And that's why B is true. 42-year-old male with jaundice, urgent gastroenterology clinic. The third thing that you could do urgently is an ultrasound scan. So a 2-week ultrasound scan if you have an upper abdominal mass consistent with either an enlarged gallbladder or an enlarged liver. So that's why C is the answer here, because this gentleman would be referred for an urgent ultrasound scan as opposed to urgent hepatology appointment. And the 4th thing that you can do is an urgent CT abdomen. Or an ultrasound scan if CT is not available, but for an exam purpose, the first line is CT. Within 2 weeks, if someone is over 60 with weight loss and one of these various vague type symptoms: abdomen pain, back pain, diarrhea, nausea, vomiting, constipation, or new onset diabetes, thinking pancreas, of course, there. But a lot of these may come under other 2-week referral guidelines as well: change in bowel habit, etc. Thinking lower GI. But bear these things in mind and make sure you remember there are 1, 2, 3, 4 different urgent 2-week referrals that you can do based on suspected upper GI cancer. For OGD within 2 weeks, a gastroenterology appointment within 2 weeks, an ultrasound scan within 2 weeks, and an urgent CT within 2 weeks. The final one here, like we mentioned, is true. 63-year-old with constipation and weight loss, urgent CT. And we mentioned the 42-year-old with dysphagia is true regardless of the age there. So if you do recall, put a comment down below if you recall doing that question live with us on one of our webinars. And if you haven't done those webinars, go back to YouTube and watch them. We have quite a few now, with lots more questions that you can sit there and pause and go through in real time. Give me a comment if you remember this question vaguely, and if it somehow, if you think subconsciously influenced the answer that you got, even though your brain may have been telling you something. Was it tugging you towards something else because of what you remember? I remember on that webinar, this question I did before, I'm sure when I remember it was B or D, and therefore you get influenced by that. Really easy for that to happen. Really easy for pattern recognition to happen from previous questions you're doing on question banks that you take into the exam, and very important to have a clean slate every single time you look at a set of answers, even if you think you know the answer already because you've done something very similar in the past. Now, there's still time to make use of the Clinical Grammar online course. This is where we do cover all the 2-week referral guidelines, but obviously much, much more as well. All the chronic diseases that you need to know, all the nice CKS guidelines that you need to cover, all the cancer stuff, all the 3 pediatric giants that we all talk about when it comes to AKT. And you've still got time to make full use of this. It's a 9-hour course. You can watch it probably 3 or 4 times before the exam. You've still got time to go through it. You can have the full PDF package. It's a massive document that we email out that's got a lot of details that you can just flick through in those final few days before your exam. It's all topic based, so chapter based, so you can flick to various chapters as you need. Don't forget the coupon Arora Video 10 for a 10% discount on anything you get for AKT, not just the online courses, but the audios, etc. Hope this helps. See you tomorrow. Can Bass will Bass.